Yawning right before fainting, syncope, is actually a recognized phenomenon. Here's why it can happen. 1. Blood pressure and circulation changes before passing out. Blood pressure often drops and less oxygen reaches the brain. Yawning may be the body's way of trying to draw in more oxygen and improve circulation to the brain. 2. Vagus nerve activation. Fainting is often linked to vasovagal syncope, where the vagus nerve slows the heart rate and widens blood vessels, leading to a sudden drop in blood pressure. Yawning is also associated with vagus nerve activation, so they can occur together. 3. Stress response. Before fainting, your nervous system may flip into an imbalance, adrenaline spikes, then suddenly crashes. Yawning could be part of the body's attempt to reset the nervous system. 4. Warning sign. Some people experience yawning, sweating, nausea, or tunnel vision as early warning signs of fainting. Doctors sometimes call this the prodrome, the before phase of syncope. In short, yawning before passing out is your body's way of compensating for reduced blood flow and oxygen to the brain, and it's often tied to the vagus nerve reflex,